Can Strangles carriers be identified and treated? The truth is, carriers can look outwardly healthy. A carrier horse is a horse that has recovered from illness but hasn't cleared the bacteria from their system. Instead, the bacteria usually hides away in their guttural pouches, 2 air-filled sacs at the back of the horse's throat. These horses look, act and perform perfectly normally, but they can harbour the bacteria for months or even years, with intermittent shedding allowing for infectious transmission. So how do we find them? The gold standard for diagnosis is a process called guttural pouch endoscopy and lavage. This involves a vet passing a small camera into those pouches to look for pus or chondroids, which are hardened clumps of pus that look like small pebbles. The pouches are then flushed with fluid and tested using a PCR test. In terms of timing, we usually wait at least 4 weeks after a horse is completely recovered before scoping and testing. The main limitation is a single swab or a blood test isn't always enough to provide evidence that a horse isn't a carrier. That direct look into the guttural pouches and testing of a wash is a good way to confirm likely freedom from infection. The good news, treatment is highly effective. Once we identify a carrier, we can usually resolve the issue completely. A vet will physically remove chondroids through the endoscope and then may treat the pouches directly with a specialised antibiotic gel. After treatment, we retest to confirm the horse is clear. In the vast majority of cases, once they are treated, they are no longer a risk to their friends, but it's still best to confirm with a final guttural pouch test which comes back negative. How do we manage the risk? The key to reducing transmission is knowledge. We don't need to fear these horses, we just need to identify them. By screening new arrivals and testing horses after an outbreak, we can find the carriers, treat them and stop the spread. It's important to remember identifying a carrier isn't a bad thing, it's actually a huge win. When you find and treat a carrier, you're cutting off the infection at its source and ensuring a safer future for every horse at the yard.